Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Our lecture today is about the pancreas. The pancreas is a mixed gland. Mixed means endocrinal and exocrinal. Endocrinal secreting insulin, glucagon, gastrin, somatostatin, etc. And exocrinal because it secretes pancreatic enzymes, pancreatic secretions in the intestine for digestion. The pancreas in the living subject appear yellowish, lobulated structure, extending horizontally or obliquely? Extending obliquely along the upper part of the posterior abdominal wall from the C-shaped duodenum to the spleen. It is a yellowish lobulated structure passing obliquely on the upper part of the posterior abdominal wall from the C-shaped duodenum on the right side to the spleen on the left side. The pancreas is divided into part lying inside the C-shaped duodenum and called head of pancreas, and its lower part extend to the left side of the middle line to form the uncinate process of the head of pancreas. After the head, there is a constricted part behind the pyloroduodenal junction called neck of pancreas. Then this large part, and the largest part is body of pancreas, and its tip is called tail of pancreas. What is the relation of these structures? The head of pancreas, what is the anterior relation and what's the posterior relation? Anterior relation of the head of pancreas is transverse colon, and inside the concavity of transverse colon there is lobes of jejunum, small intestine or particular jejunum. The uncinate process in front of it there is these descending vessels which are superior mesenteric. Therefore, we can always divide the head of pancreas into head proper to the right side of the middle line and uncinate process to the left side of the middle line. In front of the head proper, transverse colon and lobes of jejunum. Uncinate process in front of it is superior mesenteric vessels. Posterior. Posterior to the head of pancreas is the famous relation. The famous relation which is posterior to the head of pancreas, there is the infraduodenal part of common bile duct, supraduodenal part, retroduodenal part, infraduodenal part of common bile duct. Posterior to the common bile duct is inferior vena cava, no portal vein. Portal vein is behind the neck and ascend upward behind the duodenum. The head proper, no portal vein, inferior vena cava. And we said before that this relation is famous in surgery. What is the clinical picture of cancer head of pancreas? First of all is compression of common bile duct leading to obstructive jaundice. Later on, very late, compression of inferior vena cava leading to edema of lower limb. Above the head of pancreas, there is what? The pyloroduodenal junction and the first part of the duodenum. To the right side, what? Second part of duodenum. Below the head of pancreas. Third part of duodenum. Okay. What is the posterior to the uncinate process of pancreas? The head proper is to the right side of the middle line. Therefore, it is related to the inferior vena cava. But the uncinate process to the left side of the middle line. On the left side, there is no inferior vena cava. The inferior vena cava here on the left side is replaced by abdominal aorta. Therefore, posterior to the uncinate process, there is abdominal aorta. If there is cancer head of pancreas, what is the direct spread to this carcinoma? It spread posterior to the common bile duct producing obstructive jaundice. It spread more posterior to the inferior vena cava producing edema of lower limb. It's spreading upward to the duodenum, leading to duodenal obstruction. Or spread upward to the pyloroduodenal junction, leading to pyloric stenosis and obstruction of the pyloric region. Okay? Relation of neck of pancreas. This is a famous level of stab wound at the level of the quadrate lobe of liver. Okay? The neck of pancreas is marked anteriorly by pyloroduodenal junction and the first inch of first part of duodenum. What is the posterior relation of neck of pancreas? Union of splenic vein with superior mesenteric vein to form portal vein. Behind the neck of pancreas is the beginning of portal vein. Body of pancreas. The body of pancreas in cut section is triangular in shape. That's to say the body of pancreas is pyramidal in shape. And we make a cut section, this is triangular in shape. This is a famous sagittal section in the peritoneum. Sagittal section in the peritoneum. Sagittal section showing the stomach covered with peritoneum anteriorly and posteriorly. The peritoneum covering the stomach from anterior and posterior descend downward as a fold of peritoneum called greater omentum طبعا, of course. The greater omentum descend as two layers. Anterior two layers. Then reflect upward and backward. When the two layers reflect upward and backward, they meet this structure, which passing is through the horizontal part of the abdomen, which is they meet the transverse colon. The two layers surrounding the transverse colon, and they ascend upward as two layers. This is the fold of peritoneum of the transverse colon. This fold of peritoneum is called transverse mesocolon. The transverse mesocolon, the two layers meet what? Meet the anterior border of the body of pancreas. Therefore, the anterior border of the body of pancreas gives the attachment to transverse mesocolon, which is continuation to greater omentum. Okay? In this cut section, the body of pancreas is described as has anterior surface, posterior surface, and the inferior surface. And having three borders: superior border, anterior border, and posterior or inferior border. Can be called posterior or inferior. Okay? What is the relation of these borders and surfaces? First of all, we know the relation of anterior border, which is attachment of transverse mesocolon. And we all know the relation of the anterior surface of body of pancreas. What is the relation you take before for the anterior surface of pancreas? This is the anterior surface of pancreas. And the anterior to it is the posterior surface of the stomach. You take anything about stomach bed. What's the stomach bed? One of the main structures in the stomach bed is the anterior surface of body of pancreas. But the stomach is adherent to the anterior surface of body of pancreas, or there is a cavity here. This cavity is called cavity of the lesser sac. Therefore, the anterior surface of body of pancreas is related to the posterior surface of the stomach, separated from it by the cavity of the lesser sac. And this cut section, you can see the cavity in front of the stomach and the greater omentum. This large cavity in front of stomach and greater omentum is greater sac. And this is a cavity behind the stomach, separating the stomach from the stomach bed, which is lesser sac. Okay? Therefore, the relation of the anterior surface is stomach separated from it by cavity of lesser sac. Anterior border, attachment of transverse mesocolon. What is the relation of the inferior surface? Duodenojejunal flexure and the loops of jejunum. You see this in this cut section, and look here. This is the body of pancreas, and below the body of pancreas is the duodenojejunal flexure and the loops of jejunum. What is the relation of the posterior surface? The secret word for the posterior surface is 2. This is the pancreas, and this is the posterior relation of the pancreas. First of all, 2 veins. What is this vein? Coming from the spleen. Splenic vein. And what is this vein? Coming from the left kidney. Left renal vein. Therefore, the posterior surface is related to 2 veins, splenic vein and left renal. 2 arteries behind the body. 2 arteries behind the body. This large, huge artery, which is abdominal aorta. Abdominal aorta separated from the body of pancreas by the origin of this artery. Superior mesenteric artery. Therefore, the posterior surface is related to 2 arteries, aorta and origin of superior mesenteric. The posterior surface is related to 2 muscles. What is this muscle? This part of diaphragm, which is called the right crus of diaphragm. And this muscle just lateral to the vertebral column, which is left psoas major muscle. And on the left psoas major there is sympathetic chain. Behind the pancreas, behind the body of pancreas, there are 2 glands. This gland, which is left suprarenal gland and left kidney. Therefore, behind the body of pancreas, 2 veins, 2 arteries, 2 glands, 2 muscles, and 1 nerve. 2 nerves, 2 veins. First of all is splenic and left renal. 2 arteries, aorta and superior mesenteric. 2 muscles, left crus of diaphragm and left psoas. 2 glands, left suprarenal and left kidney. 1 nerve, which is sympathetic chain. The superior border of pancreas is related to what? Superior border of pancreas is related to the celiac trunk. And on both sides of celiac trunk, there is celiac ganglion, autonomic ganglion, here called celiac ganglion. And from celiac trunk runs the tortuous splenic artery along the upper border of pancreas. And along its course, the splenic artery gives the pancreatic branches to the neck, body, and tail of pancreas. Therefore, the upper border is related to celiac trunk, splenic artery, and celiac ganglion. Finally, tail of pancreas. What is the tail of pancreas? It's the part of the pancreas which lies anterior to this structure. What is this structure? This is a transverse section. This is a transverse section in the human body, as in CT scan. This is axial CT scan. Axial CT scan means the patient lies on the bed, the head and the neck here, and the lower limb toward you. And we make cut sections. And we look from front, look from below. Therefore, if you cut Dr. Wahdan here, and you look from below, this is the right side containing liver. And this is the left side containing the spleen. And on the posterior abdominal wall there is pancreas. And here the left and the right kidneys on the posterior abdominal wall. The tail of pancreas is this part in front of left kidney and in contact with spleen, and runs where? Runs in this fold of peritoneum. What is this fold of peritoneum? To know this fold, what is this structure? Between liver and spleen? Stomach, which is covered by peritoneum from anterior and posterior. The two layers covering the stomach extend to the left side, to the spleen, to form this fold of peritoneum, which is called gastrosplenic ligament or gastrosplenic omentum. It is the same. When the two layers reach the spleen, there is anterior layer of gastrosplenic. Okay? The anterior layer surrounds the spleen and reflected from the spleen to left kidney. The posterior layer of gastrosplenic reflected directly on the pancreas and runs on the posterior abdominal wall to form this layer. These are the two layers of lieno-renal ligament. This fold is called the lieno-renal ligament. It is an extension from gastrosplenic, extending backward. And in the lieno-renal, lieno means spleen. It's called the lieno-renal or spleno-renal ligament, containing the tail of pancreas mainly. Therefore, the tail of pancreas is the part running in the lieno-renal ligament in front of the kidney and in contact with the spleen. What is the arterial supply of the pancreas? The head of pancreas, we all know, it is supplied by, the head of pancreas is supplied by superior and inferior pancreatic duodenal. Superior pancreatic duodenal is branched from gastroduodenal. Inferior pancreatic duodenal is a branch from superior mesenteric. Body, neck, and the tail are supplied by pancreatic branches of a splenic artery. What is the venous drainage of pancreas? Pancreatic veins. drain into splenic vein, draining the neck body tail, while the head of pancreas is drained by pancreaticoduodenal vein, which drain directly into portal vein. Here we should stop at this important point. Blood spread of malignancy passing along veins or arteries? Along venous artery. Therefore, metastases from carcinoma of the neck, body and tail passing to splenic artery. And from the splenic artery, the metastases pass to the left lobe of liver or right lobe of liver. Carcinoma of head of pancreas. The metastasis passing through pancreaticoduodenal vein to portal vein. From portal vein to the right or left lobe of liver. Metastasis from head of pancreas passing to the right lobe of liver, while metastasis from neck body tail passing to the left lobe. Why? Because we can divide the portal circulation into left side and right side. The left side of colon, absorption in the left side of the colon only water and blood from spleen. Blood from spleen and from left side of the colon along inferior mesenteric, which drain into the splenic vein, and the viscosity of this blood is very thin fluid. Is this fluid can be compared to the fluid and the absorbed food material in the superior mesenteric? The superior mesenteric vein absorption from jejunum, ileum, fat, protein, carbohydrates. Therefore, the viscosity of fluid in the superior mesenteric vein is very high. When the fluid with low viscosity on the left side runs, and the fluid from high viscosity runs on the portal vein, is the two streams mixed together? No. The two streams passing from a splenic vein on the left side of portal vein, and from superior mesenteric vein it passes in the right side of portal vein, unmixed. When the portal vein divided into left and right branches, blood from a splenic vein passing to the left lobe of liver, while blood from a superior mesenteric pass to the right lobe of liver. Therefore, any metastases coming from primary drained into a splenic vein produce metastases in the left lobe of liver, while any malignancy drained by superior mesenteric vein will produce metastases in the right lobe of liver. Example: colon, cecum and ascending colon. If there is malignancy in cecum and ascending colon, it will produce metastases in the right lobe of liver, because the right side is drained by superior mesenteric. While metastases in the left side of the colon produce metastases in drained by inferior mesenteric to splenic, left side of portal vein, left branch of portal vein to the left lobe of liver. Okay, this is an important MCQ in FRCS وفي المعادله الامريكيه والحاجات دي in American board. The head of pancreas produce metastasis in, and the neck body tail produce metastasis in. Okay. What is the lymphatic drainage of pancreas? Tail, body, and neck drained into pancreatico-splenic lymph nodes. Pancreatico-splenic lymph nodes along the course of splenic artery to celiac lymph node. Lymphatic drainage of head passing to celiac lymph node directly. From celiac lymph node, we all know malignant cells, they may pass to, from celiac lymph node, retrograde lymphatic spread along the lymphatics around the hepatic artery to lymph nodes in porta hepatis, where it may compress the common bile duct, producing obstructive jaundice. From lymph nodes in the porta hepatis, retrograde lymphatic spread around the ligamentum teres. Malignant cells may reach umbilicus, producing malignant nodules umbilicus called Sister Joseph nodule. From celiac lymph node, malignant cells may ascend upward in cisterna chyli thoracic duct to left supraclavicular lymph node, which is called Virchow's gland, producing positive Tourvoisier sign. In pancreatitis, leakage of pancreatic enzymes, exudate, and collection of fluid in. If there is here pancreatitis, pancreatic enzymes, exudate, blood, discharge will connect in lesser sac, producing a swelling, pushing the stomach and appear as a swelling here in the epigastric region. This swelling is called, you take pancreatitis in pathology or not? Collection of fluid. Any collection of fluid is called cyst. This cyst in the lesser sac is called the pseudo pancreatic cyst. Pancreatic cyst, okay. Why it's called pseudo? Any true cyst is lined by epithelium and containing fluid. This cyst is not lined by epithelium. It is lined by inflammatory cells. Therefore, this cyst is called pseudo pancreatic cyst, which appear in this patient as epigastric swelling. If there is pain from pancreas, pain due to pancreatitis or malignancy in pancreas, what is the feature of this pain? Pain is a very late symptom, producing pain in the anatomical site of pancreas. What is the site of pancreas? Epigastric pain. Radiating to the back. You should ask the patient, what aggravate and what relieve pain? The patient will say, like a music, the pain increasing on lying down and relieved on leaning forward. What is the cause? Behind the pancreas, there is a retroperitoneal autonomic nerve plexus around the aorta. Behind the pancreas, the aorta, and surrounded by autonomic nerve plexus. When you lean forward, the pathology in the pancreas go away from the nerves, leading to relief of pain. But when you're lying down, the pathology will compress, irritate more and more the autonomic nerve plexus, leading to aggravation of pain. Therefore, pancreatic pain is very famous in the epigastric pain, radiating to the autonomic nerve plexus in the back. And the pain is aggravated on leaning, on lying down, and relieved on leaning forward. Okay, this is the pancreas.